to me, the main thing is the pain. Because you don't know how I suffered the pain, right? Waking up, the pain wake me up, okay? I'm sleeping and as I get up because, oh, my shoulder, oh, something grinding, like hammering, oh, it's so, I tell you, it's like labor pain, you know. I have to really get up, go to the fridge, and I can't even eat that painkiller because I know I have to eat something first before I eat the painkiller. You see, that's much I'm so careful about. I don't want to get ulcer. I thought, I really don't know why I got arthritis. So I went and see a doctor, arthritis doctor. So he checked on my markers, said, only 1% up, not really arthritis. Maybe it could be something. Then I thought, okay, I don't believe in allopathic medicine, right? Because I don't like to take medicine. So I'm so glad that I found this one, but I don't know how good but I read the review from Health Within. I said, I think it should be good you know. This is my last resort, right? Initially, I followed everything because I want the thing to work. I don't want to say, oh, it doesn't work because you didn't do this, you didn't do that. No, I will do exactly what you want me to do, okay? And if it doesn't work, not my fault, okay? It is something wrong with the supplement, or maybe you didn't give me the right thing or whatever. So I follow exactly for 2 weeks. Then I come back. The result was fantastic. Okay, after 2 weeks, the joint pain and all that was 80%, right? A little bit of pain.
Reduced?
Reduced. A little bit of hair pain, but not the excruciating pain where I have to take painkiller. Then until to date, it's like I would say 95% free. I can even think of going anywhere, traveling. I don't have to worry, oh, can I carry my bag or not? The pain might come, you see. So nothing for that. Dr. Lee is a very knowledgeable doctor, right? And he will heal you for sure, 100%. Even not 100%, between 90 to 100%, okay? Range. You want optimal health? Going back to something I used to play games I used to walk around, not feeling without a cane that is the right place to come. So it's what you want. So my advice is that this is the only place that can heal you. No, nothing else.
Okay.
You see, my husband passed away 2 years ago. 2003. Right. So before he passed away, everything was okay. I mean, actually, I don't have any problem. No high blood, no blood sugar, nothing. Okay. So when I was taking care of him,
You're feeling all well?
I'm all well.
Okay.
But I didn't eat properly. But because he is sick.
Okay.
So if he is sick, I feel that I pity him. So I also don't eat. So I lost in that 3 weeks or so, or month. I lost 20 pounds.
Wow, that's a lot.
That's a lot. Yeah.
Within 3 weeks.
3 weeks. So when I lost a lot, and of course he passed away after 1 month, right? So every time in the hospital, going there, so I'm very stressed looking at him and all that. So it's all building up inside me. But I didn't feel anything. Then when I lost a lot of weight, I was very thin, and I slowly, a little bit like maybe joint pain. I thought, oh, a bit of pain here, the joints, and then I thought, oh, okay. I thought maybe nothing I didn't really, Then slowly, more and more pain from my palm joints, my wrist, the knuckles, and my shoulder. So I used to put the plaster, that, and this side, and sometimes my hip joint also pain. It come and go, and that time more often the pain comes, like the attack comes more often, and I would take painkiller. it will wake up middle of the night, like 3 a.m. The pain is like very excruciating, you know. It's like grinding, you know. Somebody taking a hammer, hammering your bone, you know.
Where
kind of pain.
On the hand, all over?
Oh, one. It will attack one thing first. Maybe 3 days time, it will attack your wrist.
Very interesting.
So it goes to different places.
Okay.
So I know it will, the symptom will come like slightly pain. Then I know it's getting more and more and more. When I sleep, it just wake me up, and the pain is so painful. I have to hold and I have to go and take painkiller already. Then after I have to wait for 3 hours when the painkiller, you know, get absorbed, and then I'm feeling okay. So to me, I have to see. To me, the main thing is the pain, because you don't know how I suffered the pain, right? Waking up, the pain wake me up. Okay, I'm sleeping, and as I get up, because my shoulder, something grinding, like hammering. It's so, I tell you, it's like labor pain, you know. I have to really get up, go to the fridge, and I can't even eat that painkiller because I know I have to eat something first before I eat the painkiller. You see, that's much I'm so careful about. I don't want to get ulcer. So I have to make bread, put some peanut butter, chew, food. Then only I take the painkiller. Then have to wait. I can't lie down because it's still paining. So I have to sit down, wait, look at the time. Okay, 1 hour already. Then slowly get him, then I go and sleep. Like that. And then go to work, drive to work. At one time, can't even put the touch and go also. This side pain, this side cannot. So wind down, this arm have to go and put like that. And I still go to work. How I suffered all this inconvenience and pain, you know. Sometimes here pain, I can't even drive, goes to reverse. You can't even do because it's pain. This hand have to do this way. This hand will help. This hand will help like that.
Very interesting.
That painful. So it's been going on like that for months. I thought, I really don't know why. I thought arthritis. So I went and see a doctor, arthritis doctor. So he checked on my markers. Says only 1% up. Not really arthritis. Maybe it could be something. Then I thought, okay, I don't believe in allopathic medicine, right? Because I don't like to take medicine. So I look up, and then I saw there's another functional medicine doctor. So I went to see her. So I took a blood test, and I found that my the word is ESR. That is a reading of information, you know. It was so high. It was like supposed to be 20. Mine is like 70. So I said, oh, no wonder. I said, yes, your inflammation is very high. Cortisol all that all high, you know, hormone. And then of course she looked at that. She's looking at my blood testing the normal blood. Red blood cell is very low, you know, this and that. So to me, it's like, oh, am I getting cancer or what? Because to me, it's red blood cells is low. So
hemoglobin also low.
Everything is low. Very low, and then I lost so much weight. You know, so that's all. She only look at that. So I just went to her just to get my inflammation down, which is what she wants, you know, to get it down, because this is the cause of what giving you the problem. Then she will move forward like that. So she treated me with herbs and supplement and all that, but hers didn't really. I mean, the inflammation just dropped 40%, right? But I still have a little bit of pain. Only 30% only. It helped me. Still, there's pain that I also have to take painkiller, but not so often. But still, so I thought this one doesn't work at all. But actually, I have made appointment to come and see Heal Within. But the thing is, with Heal Within, the booking is very tight. So if I were to make, I would say, oh, maybe next week because pain. Oh no, the booking will come 1 month's time. So in that 1 month, that's why I seek for another place because of that. Right? So finally, October last year, I only managed to come where I already got everything quite, you know. So when I came and Actually, all this I Google to find out earlier, you know. And I was so happy because I read a lot in YouTube about this functional medicine, you know. And I told myself, how I wish Malaysia had got this kind of, you know, place where we can go, you know.
Yes.
Because people don't know,
Yes.
right? They always go and seek doctor.
Yes.
And they don't know. They only look at your symptoms.
Yes.
Oh, you got this, they treat. And everybody they treat is equal. You take this pill, right?
Yes.
Everybody take the same pill,
Simple. Yes.
right?
Yes.
So that's why I don't want.
Yes.
So I'm so glad that I found this one, but I don't know how good lah. But I read the review from Health Within.
Yes.
I said, I think it should be good lah. You know,
Yes.
this is my last resort,
Yes.
right?
Yes.
And the appointment, the first appointment, their testing procedure was very thorough, and I read about it.
We'll go through that. So that is how you,
Yeah,
you
that's,
found,
that's
you found healed with it.
That's how.
Okay. Okay. Good.
Okay. The thing is, because they're going to test my dry blood
Yes.
and live blood.
Okay.
Now I haven't heard of that before.
Okay.
I think this is the first place
All right.
that does that.
Okay.
Right? Normally you get a blood test, you got all the reading
Yes.
and all that.
Yes.
So okay, I mean of course they took my weight and everything like, you know, thorough that, and then he also checked thoroughly on me, skin how you know, and your body, because everything very thorough to see whether because one mole or one dot or this and that might be cause of something.
Correct.
Could be your liver,
Yes.
could be this, could be that. I wouldn't know.
Yes.
Doctor only would know.
Yes.
So he did a very thorough check on my physical. Okay, number one, and the two is he did the dry blood test and the live blood. Dry blood is taking, you know, your blood, dry it,
Yes.
and then you can see what.
Yes.
So you see, he told me that now the normal blood cell is round,
Correct.
and they are floating all over the place.
Yes, yes.
That's healthy.
Yes.
But yours is like a sausage, all stuck together. A lot of toxic, right? Inflammation, toxic, and all that, which I know I had already, but I don't see it. So when I saw, it's like a miracle to me. To see my body, you know, my blood, you know. So I said, so doctor said, you know, this one, you know, not healthy lah. I mean, toxic lah, you know. We're all stuck together. You know, it's not moving healthily. It's not no oxygen or what. I don't know. I think doctor only can say what, you know. So when I look at that, I was already convinced this is the place, because he is not plucking from the air and telling me, you know, you got this. No, it's from your blood. It's coming from your blood. Normal is like that. Yours is like that. So I want to be like that. I want my blood cells to be floating like normal. So that is why I started the program, because of this.
Okay, that convinced you basically.
Yes, that is really convincing me.
Okay, besides that, did he like explain to you anything in terms of the logic behind the treatment that says, okay, this is even more convincing, like for example, deal with the root causes or something?
Yeah, he did explain to me later on about what is the
the mechanism of why you're really getting this pains and all
okay,
this?
you see, so when I first see him, he still have to study, he got to know me more.
Yes.
I'm a stranger,
Yes.
right? He only saw my dry blood and my live blood. So he need to take a blood test also. So he take a blood test, and then also he want to check on my hormones also, right? Because I'm 69. So he need to check what sometimes it goes down or what. So he can't really let me know exactly what. He has to see the test first. Then only, you know, he can say, okay, you got this disease, your toxic come from this, and all that.
Correct.
Correct. So I did, because I want to solve my problem.
Yes.
Right? The pain was so bad that I just don't want it. So sometimes, you see, when you want to solve something, it doesn't matter. You just want to get it done. And you found the right person, and Dr. Lee is a very knowledgeable doctor. So I find that I think this one worked. I mean, no harm trying, because I already tried other places. So what else am I going to do? The most I'm going to spend money. If it doesn't work, then well, it's too bad, because that's my last choice already.
Yes.
You know, so that is why I just carry on. I went further with whatever test he wants to do.
Yes.
So he did the thorough blood test, thorough, I mean, really thorough blood test.
Correct.
And so I just went through lah.
Okay. He did any heavy metal tests and all for you?
Yes, everything.
Okay.
Heavy metal also.
Okay.
Yeah.
Anything was found in the heavy metal test?
Yeah, heavy metal very high.
Okay. So this was like new information to you, probably. You probably are not aware of this.
I'm not aware.
And your research during your reading all the time, you never came across these things like heavy metal toxicity?
Yeah, I do come across, but I don't know that. I know heavy metal comes from certain things, you know, food. But I was very careful already.
Yes.
So I didn't know what other, you know,
yes.
the thing.
Understood.
So the treatment is normally it's a supplement. So when he got the test, then only he can give you, because everybody is individual, right?
Yes.
So in my case, okay, you got your toxic level, right? Heavy metal also very high. So he also find that maybe from plastic, because I've got drinking water from the plastic, right? So probably from that, because I don't take outside food so much. Processed food is really nothing lah, unless once in a blue moon I will take that. So salmon also, only when my husband passed away, then only I took salmon, but I was very cautious lah, that I make sure it's deep sea, you know, because they say salmon is so toxic, you know, this and that. But heavy metal probably comes from there a little bit, but I really love salmon. So, you know.
But that also you never ate before.
I never ate.
Not like
I never ate before, so
exactly.
yeah. But I really love, because my husband don't like fish, you see. He's very fishy and all that. So so when he passed away, I just eat what I like, which is salmon, broccoli, yogurt, all that. Very simple. That's my dinner, you know. So my lunch is, I make my own salad with all the seeds lah, fruits lah, everything and all that. So there's nothing additives or anything there. So I think the only artificial that comes to my body will be water from the plastic bottle, or is my hair dye, my color. Okay, which I can't help it lah. I have to color my white hair. So, but the doctor said there are not so much, but it's more like, I think it's the plastic lah. It's the some other form of toxic lah coming from, you know. So anyway, I throw away all the plastic container, everything, and I use glass now. Glass or metal. Even I bought, you know, from the Indian shop, you have the metal kind of container and all that. So I bought that and put in all that. So I've changed all that.
Okay, great, wonderful. Okay, so then he gave you, I think, detoxification.
Oh yes,
so
tablets. No.
Tablets.
Yeah.
Was there any like a fasting kind of detox or anything?
That detox is not fasting. Is to cleanse the gut, the colon.
Okay.
Yeah,
but
that one.
There's no like only liquid diet or nothing.
No.
Okay.
No.
So you could eat.
So basically, it's just to give me that tablet, you know, for that to detox,
cleansing. Cleanse.
Yeah, and then also sweat detox.
Okay.
There's like a sauna, just sweat out the
exactly.
Yeah.
He explained to you anything further, like what else it does for you, and what is the purpose of
yeah,
that?
that's he does let me know lah, because that purpose to when you sweat, you know, it also detox the sweat, you know. It's getting rid of whatever toxic.
Getting of all the toxins, opening up the channels, dilating your blood vessels. Also helps with your calming of your nervous system also.
No, to me is as long as it makes sense.
Yes, correct.
Because I read a lot, and I Google a lot on YouTube, listening and all that. I mean, sometimes I have to plug also. One say good, this one say no good, the one say that. So out of 10, then I say, okay, I think that one is good.
Yes, okay.
Right?
Correct.
It's just like spinach.
Yes.
It is good, but it's not good also.
Yes.
It has got purine.
Yes.
How you cook it. This and that. So there's so many things.
Okay.
So I dive into so many things and I must analyze first.
Yes.
And then when I come and see Dr. Lee,
Yes.
he is telling me the same thing which what I'm already thinking.
Yes.
So I say, okay, that means he's good.
Yes.
You see?
Yes.
So that's how I analyze also.
Okay.
I don't blindly
Yes.
see,
Yes.
you know, because you have to be educated
Correct.
in order to get yourself.
Yes.
Not just blindly go or doctor say, oh, okay, that. You also won't get healed
Yes.
because you're not doing the right thing.
Correct.
So I have to be very knowledgeable,
Yes.
and I find a doctor who is also knowledgeable,
Yes. Yes.
and I combine.
Yes.
That's how I trust him.
Yes. Okay.
Tablet.
Intravenous drips?
Intravenous drip is only one time only.
Okay, you
One
did.
time, yes, I did that.
Okay,
one time.
did he tell you what was that? Chelation?
I don't know, I can't
You
remember.
can't remember.
I can't remember.
What was the color of the bottle you saw? Was it like plain color?
Plain color.
Plain color.
But it's only one time only.
One time. Okay,
One
but
time.
that's IV chelation.
Oh yes, huh?
Yeah,
oh.
that is to bind the heavy metals from
Oh,
and then bring it out of the
then
body.
okay.
Yes, yeah. And
Yeah, I think so. Now I remember something like
Exactly.
that.
Correct. And then you have nutrition, nutrients.
Yeah. A
And
lot,
then-
okay. A
yeah.
few, this and that.
Yeah. Some of them were like nutrients, and then some of them were probably this biological hormones.
Yeah, hormones also. Yeah.
Yes, hormones. And then did you do
I like the detox. Then the
colonial tox?
I like that one.
Okay. So in summary, you did detoxification. Then you also did the second detoxification, which was heavy metals, was intravenous.
Oh yeah.
That's
Intravenous.
right,
Yeah.
IV chelation. And then you did far infrared therapy, the sweat detox. Sweat detox. The sweat detox, how often you doing that?
Of course, he wants me to come every week at least.
Yes.
But all depends lah.
Okay.
Saturday I'll come, maybe alternate Saturdays if I can. You know, if they got place and all that.
Yes.
Then I'll do.
You feel any better like after the session?
Oh yeah, I love the detox. Very nice. You really sweat, and after that you feel very good.
Refreshed.
Yeah, there's a feeling. Of course,
Yeah.
good.
You
Yeah,
feel
I love it.
refreshed,
Yes.
Very good. And then one more thing, food
Yeah,
he gave
food.
you. He customized your diet for you. Anything specifically he said not to eat?
No, because I told him what I'm eating, so he said, okay, fine, everything you're
That's
eating
okay.
is okay.
Okay. Oil.
Oil,
did you
yeah.
use? He said to change the oil or something?
Because he knows I don't take vegetable oil. If cooking, I will only cook oil with either virgin coconut oil, olive oil, these two oil. Okay, and that also I very seldom cook. I bake, right? And he gave me the omega active, that one, omega oil, which I love. Right? I love that oil. So oil-wise is okay. I don't take other oils.
Okay. Let's talk about the results that you got. One is that, of course, you had your live blood within 2 weeks.
Yeah.
Yeah, okay. But in terms of your symptoms, the joint pains you were mentioning
Yeah.
Tell me the level of severity that it was before and how is it now?
Okay, after 2 weeks, the joint pain and all that was 80%.
Okay.
Right? A little bit of pain.
Reduced?
Yeah,
Okay.
reduced. A little bit of hair pain, but not the excruciating pain where I have to take painkiller.
Okay.
Then until to date, it's like I would say 95%.
Okay.
Free.
Okay.
I can even think of going anywhere, traveling. I don't have to worry, oh, can I carry my bag or not?
Okay.
The pain might come, you see.
Okay.
So nothing
Free of
for
that.
that. Whatever pain I have is actually, if I were to take heavy things, and then the joints,
Okay.
that one.
It's like stressing the joints and that.
Yeah. Because my joints, I think, is already, the bone probably is weak or what. I think so lah.
Alright,
But
okay.
nothing to do with that. This pain is a different pain, This
Okay.
pain is like something grinding, It's like eating up, and then it just come digging into you, that kind of pain, which I don't know. Not like, okay, let's say you go to the gym, right? You hold and all that. Okay, then you get a bit of pain, then it will go off the next day, right? But this is not. It will just come that little pain, and then it will grow, and then it is so, you cannot tolerate. You need to have painkiller. Until I have to bandage my hand and all that, so that I don't move the joints and all that, and then sometimes it gets swollen.
Like that, huh?
Yes.
This is that attack you were talking about.
Yeah, that's the attack. No?
So now no more?
No.
Okay. Stiffness?
Stiffness? No, but of course, occasionally my joints because I'm of this age, I have to do a little bit of stretching and all that.
You have right knee pain?
I used to, but I don't really.
Okay.
I don't have it.
Okay, now no pain?
No.
No more painkillers?
No. Ever since I'm here, no painkiller. So when there's no pain, my life is so much better, right?
Of course.
I'm happy. You know how is it to be pain-free?
Yes,
I tell you, you just cannot imagine.
Okay.
Initially, I follow everything because I want the thing to work. I don't want to say, oh, it doesn't work because you didn't do this, you didn't do that. No, I will do exactly what you want me to do. Okay? And if it doesn't work, not my fault, okay? It is something wrong with the supplement, or maybe you didn't give me the right thing or whatever. So I follow exactly for 2 weeks. Then I come back. The result was fantastic. You know, I told you the cells that floating. Yes, I got that.
In 2 weeks?
In 2 weeks.
2 weeks treatment?
Yes. You know, no more sticking like sausage here and there. It was floating. I was so happy, you know, I tell you. That was where I want to carry on.
Motivated you?
Yeah. 2 weeks.
Exactly.
No need 1 month. Because I follow exactly.
Yeah.
Because I'm very disciplined with my food already. I don't eat outside. The only outside food I eat is, I love thosai lah. So I like chutney. So there only, okay, I eat outside. Indian food only. I don't eat Chinese food because a lot of chemicals lah, this and that and all that. So that is the only thing I eat, outside food. Other than that, I don't eat. Okay. I eat, everything is from my kitchen.
Okay.
Salt, oil, everything is from there. So I want to see, if I do all that, what else? Right? And he's giving me all this, what else?
Exactly.
If I don't get result, there must be something. So that was the 2 weeks result. You know, to me, actually, I believe in myself. Nobody can help you. You have to help yourself. All right? Staff, of course, they say, don't worry, good, right? You know, end of the day, it's you. When you go back home, it's you. If you are not going to do it, nobody can force you, right? So to me, I believe me. I have to help myself, right? So other people, they are not. No doubt, I mean, the staff is good, right? Of course, that is, I mean, no doubt about it. But I would say it's me that is helping myself, right? Even doctor, like you say, he can give you the best supplement or medication and all that. Then you go out, you know, have a lifestyle where you never mind lah, I'll eat this lah, that lah. No, not me. You know, I make sure I want to follow, because it's me, my body. End of the day, it's me.
Exactly.
So the motivation comes from, I want to heal myself, and Dr. Lee is the one helping me, because he already diagnosed and he's helping me to heal myself. End of the day, it's me. Right? No one else. So
exactly.
That's the motivation. Is I want. I really want.
100% accountability. Like it's me. I have to do it.
Yes, I have to do it. You know, no other. You cannot say just like a smoker. Or maybe you take this pill or chew this gum and all. But end of the day, you don't need all this. It's your willpower. You know, just tell yourself, I'm not going to do it. So end it, finish. how I justify is, if I want to heal myself, no, you know what the old saying is, no, I'll do anything. I'll do anything if I don't get this, to get rid of this. So now I'm going to say you're going to pay, okay, 5,000. You can afford, you don't want to do. So what do you mean by you'll do anything? Huh? I didn't even ask you to die, you know, or cut your hand, you know. Right? So to me, that is the thing. I will do anything to heal myself. So I will pay because it justifies what result it has given me.
Correct.
That is the thing. If there is no result, of course I won't. Why should I pay? Anything is the same.
Yes.
It can be a beauty cream, it can be whatever cream, 1,000, but still the same. It doesn't make no difference.
Correct.
So to me, I justify in that result.
Yes. You're in a position that you just want to heal these things.
I just want to heal and maintain that the thing doesn't occur.
Yes.
So this is the place.
Yes.
Eventually, whatever lifetime I live pain-free,
Yes.
without medication.
Yes,
I can go anywhere without thinking.
Yes.
I would tell anybody, okay, you got any illness, you got any problem, illness lah, cancer lah, like what I'm having is chronic inflammation, okay, causing me all this, and chronic inflammation, you not heal, it will lead to cancer also. Yeah? So don't waste your time going to allopathic medicine. Doctors, I mean not doctors lah, because Dr. Lee is also a doctor. Other allopathic lah, they don't know because they can't heal you. They only suppress your symptom, right? They will give you, oh, you got this symptom, you take this pill, you take statin lah, blah blah blah, oh, you high cholesterol, oh, that's bad and all that. But Dr. Lee will tell you, actually, all this high cholesterol thing is not a problem, you know. So the right person will know exactly and give you the advice. So don't waste time on other place. Just come to heal within, right? Dr. Lee is a very knowledgeable doctor, right? And he will heal you for sure, 100%. Even not 100%, between 90 to 100%. Okay, that range. Yes, it's a bit costly, but that is what you want, isn't it? Unless you complain, oh, so expensive. Okay, then you go and pop your medication. Very simple. It's a matter of what choice you want. If you want this or that, then it's up to you. You want optimal health, going back to something I used to play games lah, I used to walk around not feeling without a cane lah. That is the right place to come. You see? So it's what you want.
Exactly.
So my advice is that this is the only place that can heal you. No, nothing else.
Okay.